I'm Mina Malik Hussain and you're watching The Coffee Table. And as you are aware, and as my ribbon should indicate, it's October. And October means that we are all over the world raising awareness for breast cancer. And this show is exactly that. So at the end of the show, I expect you all to be sharing this in huge amounts and to be helping us in creating more awareness about the disease because it is huge. The numbers are incredibly high around the world. In South Asia, they are higher. And within South Asia, Pakistan has the highest incidence of breast cancer so far, which is a very serious thing. Luckily, work is being done. We have amazing doctors, we have amazing infrastructure. We are working on it, but we can't make any progress unless we know exactly the nature of the beast that we're dealing with. So today, joining me on set is Omer Aftab from Pink Ribbon, Pakistan, and Dr. Zeba Aziz, who is an oncologist, who used to be a professor and the head of the oncology department at Jinnah Hospital and now continues to practice here in Lahore. Hello and welcome to the show.
Thank you.
Sort of dive right in.
You.
So sort of, as I like to say, to begin at the beginning.
Okay.
What is breast cancer? And that sounds like a very sort of obvious kind of question, but we'll just start from there.
See, let's just say breast cancer is the cancer of the breast very simply for all the women and men in the world. We all know what breasts are.
Yes.
But it's not just one type of breast cancer. There's several different types of breast cancer. As we go deeper and deeper into the science, what we find is that there are different types and you can identify right now about 20 or 30 different types of breast cancers for which different treatments may be available. And that is why the survival of patients is different.
So, how are there so many different kinds of cancer?
When you talk about genetics, when you talk about environment, when you talk about a woman's life history, obesity, smoking, alcohol, everything together, they all contribute. Just like we are all different, breast cancers are different.
So the sort of, so there are different ways and there are different sort of ways or symptoms. Is it correct to say symptoms?
No, the symptoms are the same. Everything, the initial diagnosis is the same. The thing is that you have to come early. That is where the survival difference occurs between the Western world, more developed countries, and country like ours, because we have generally late stage disease. We generally come with stage 2, 3, higher stages 2 and 3 than what we see in the Western world. Women tend to come late, and there are several reasons for that, which we'll delve into later.
Quite right. So, Omer, you've been working for several years now on, for this cause, and I know that that Pink Ribbon has been working towards developing a hospital, which is a specialized hospital, and we also know that breast cancer is killing 40,000 women annually in Pakistan. So, what's going on?
Well, unfortunately, at one end, we as the highest rate of breast cancer in Asia. On the other hand, the taboos around this subject, those were the hurdles. So when in 2004, when we formally launched the Pink Ribbon campaign, it was a very difficult situation. All the TV channels, they blacked out. They said that we can't take the B word on television. So we had to fight for many years with lots of TV channels that this is a disease which is killing thousands and thousands of women. And how come you tell us that we can't talk about it?
Yes.
So at every level, for example, when we initially were planning to start a youth awareness program, I went to one of the very, I would say, progressive girls' college in Lahore. I was very confident that we'll have a session there, and I was surprised when the principal, she said, "Oh, sorry, we can't hold breast cancer awareness session." So for all of these years, especially for our early 10 years, our whole focus was to create space around talking about this issue. And to create the urgency that how important this issue is, and the thing is that this is the only cancer which can be diagnosed at early stage because all the symptoms are external. Rest of the cancers, they grow in your body, and you find
may
it
or may
very,
not find
exactly. But breast cancer is the only cancer which can be diagnosed at early stage, and if it's diagnosed early, chances of survival are more than 90 or 95%.
Which is amazing. That is incredible. So these symptoms which are external, Dr. Aziz, what are those symptoms?
Basically, what you feel in the early stages is a lump or anything unusual which you feel in your breast, you should come. But that doesn't mean that everybody from the young age for 15 or 16 should start coming it unless they have a strong family history. But after the age of 35, 40, I would suggest in our women, they should do a breast examination every month after the menstruation is over and see what their breasts feel like. And I strongly advise women to do that, not daily, not every week, just once a month. And then they should keep on doing it. And if they can afford to get a mammogram annually, they should get it. We don't have a mass screening program because it's very expensive, and I don't think if the government will have to divert all their funds to mass screening program if they start it. So it's not very practical for them to do it. If a woman can afford it, annually or every other year, they should get a mammogram done. And after the age of 45, I suggest that women should go to doctors once a year and get themselves checked out.
Like
because
a complete checkup.
Because they are the pivot of the house.
Yes.
Without a mother, without a wife, without... you can't run the house. The kids need you, your husband needs you. You have to grow old with your husband.
Yes, ideally.
Quite and what I find is that women don't prioritize their health. What happens is they will spend the money on the children, the husband, everything else. And that is why I feel there are two areas where we need education. One is the men. The men who are the husbands, who are the brothers, who are the fathers, who should ask their women in the household that if they are all right and what needs to be done. The second is a physician education, general physicians working in the periphery, working everywhere else. That, we did a survey and we found that only 30% of the physicians ask the women when they came in, do you have any changes in your breast or anything? Because probably you don't think about it and you'll say, okay, whenever the woman has it, she'll come forward. But by the time she comes forward and feels a lump, it is in stage 2 already. So basically, it is early detection where you will have a lot of survival.
That's kind of, I'm surprised, because do you think that, Omer, this is also a kind of subset of these residual taboos around the female body, or people don't want to kind of...
Well, I think there are 2-3 different things. One is the patriarchy, the patriarchal society. So we see that being a patriarchal society, women's health comes not in the low priority, whether it's at the government level, whether it's at the household level. So and the example is that, for example, with COVID, the government, they set up a national control command center, and we did an excellent job. So this means that we as a country, if we want, we can prioritize something and we can get it done. But when we see breast cancer, we don't see that kind of commitment on this issue, whereas we feel that breast cancer is a bigger pandemic than corona for at least for Pakistan, because the numbers are much more higher.
Really? The mortality of breast cancer right now?
Of course, it's like if it's annually, it's 40,000, and in corona it was just like maybe 6,000-7,000 by now the death. So breast cancer is much more serious than COVID. But we don't see that kind of urgency at that level, and then at the household level, and then especially when something is related to women's sexuality, then we see that at our in our society it becomes more challenging and difficult to address that, and that's why we still come across lots of cases in cities like Lahore, Karachi, Islamabad, where women would still hide it even from their family. They would just die, and they'll not tell anyone that they are being diagnosed with breast cancer. So taboo is still, unfortunately, very much there. and we really need to address it, and that's why
keep having these conversations. Now, sort of coming back to symptoms, because I know that these are also other things that one can look out for. For example, discoloration, or like your skin pitting.
That's more advanced disease. I'm talking about really early disease. And that early disease is just do a regular breast examination and know your body. It's not only the breast, but know your body, because you should respect it. That's the health which God has given you. And I think you need to respect your health.
And like Omer said, that sort of idea that, I think this is a cultural problem also, that we are not encouraged to know our bodies.
I think it's changing. I started working here in the 90s, and what I found in the last 30 years, that the stage of the disease has come down a little bit. There is more awareness, more and more women are coming. Maybe this women's empowerment, you should have a show and find out whether it is true or not.
Good job, Pink Ribbon.
but more and more women are coming in, and they come earlier now, somewhat earlier. The only problem is Aga Khan did a survey, and what they found was that working women come at least 6 months ahead of non-working women. But that study was done in 2003 and 2004. So now this is also changing. But you know, like if you don't have money, you don't want to spend on yourself. It's not as much as a taboo as the financial implications. Because you know, once you find out, treatment is expensive. There's no two ways about it. You go to a government hospital, it takes ages and ages to get things done. Even if you come to a private hospital, you're financially depleted. But if you have an early diagnosis, it's worth it. You go buy a gold ka set or whatever, and you find that you spent millions on it. You go to a designer shop, you find you spend so much money, but early cancer diagnosis and treatment is a lot cheaper than you think.
Right, which is why it's a sort of two-pronged thing. It's cheaper, and there's also a 90 to 95% rate of survival.
And then the surgery is also smaller. Your breasts don't have to be taken off. You just have a lumpectomy done. That means that the tumor is removed, and that's
the rest of it is there.
And you know, the rest of the body is there, and you really do. And there's so many new treatments, and you don't have to go through that much torture as you would go 20, 30 years ago. So I think women need to be more powerful and more aware of their body and more empowered. That is the message I would like.
We're going to take a very short break and come back to this very fascinating conversation. Stay with us. Welcome back to the coffee table. We're having a really, really informative conversation about breast cancer with Dr. Zeba Aziz, an oncologist extraordinaire, and Omer Aftab from Pink Ribbon, Pakistan. Again, doing fantastic work for awareness. And you know, these conversations keep furthering it. So, when we talk about cancer and we talk about diagnosis, we often talk about risk factors. So, Dr. Aziz, since you are a doctor, what is the risk factor, and how do they vary from person to person?
See, the risk factors for breast cancer are several, but like the majority of them have no risk factors. But if you look at it, early menarche, late menopause, number of children, breastfeeding, and it's not just you breastfeed for one day and you say, I breastfed my kids. No, it has to be 6 months to a year at least. And then you have obesity, you have smoking, and the most important thing is hereditary breast cancer, which occurs in about 10% of our women. And this is mainly because of intermarriages. So first cousin marriages, close relatives marrying each other. So 10% of our breast and ovarian cancers, even male breast cancers, you have to do genetic testing in these. And say, let's see if there's something, and new drugs have come out for them. And to prevent the next generation or the siblings from developing cancer, if we do genetic testing, we can identify the family and tell the people who are healthy to look after themselves.
And I think that's very important, that men who belong to families that do have higher risk factors need to keep an eye on their own health and be screened, because it's not just something that happens.
Just keep an eye and screened. And it's not just breast, there are other cancers like prostate and stuff which are also related to genetics.
Oh, so that's a sort of different...
I mean, we're going into prostate, which you should have a prostate thing also.
exam for. But, but still, it's a sort of general awareness of how it's not just a female problem and how
it's a problem of
men also need to be, because that's where the sort of family history kind of comes into play. So, Omer, I know that you have a lot of statistics as well. Do you feel like maybe 10 years ago, older women were getting more cancer, but now younger people are getting? Is there sort of some change in the demographic?
Well, first of all, yes, there is a change that since 2004, when we started the campaign, now Ministry of Health tells that there has been 30% increase in patient turnout in breast clinics, which is encouraging. At least, women, they have started coming to hospitals a bit earlier. One another thing in terms of the risk factor, which this year Pink Ribbon has themed our campaign Become a Better You, because latest studies are showing that 40% of cancer is preventable with lifestyle change.
Really?
Yeah. So if you eat healthy, if you have good mental health, if you do exercise, so 40% cancer is preventable with lifestyle change. So we seriously need to focus on our healthy lifestyle. And then this year for the Pinktober campaign, we have launched our Pink Ribbon Call for Action for government. And one of the aspect of this call for action is that we are suggesting government to look into those food ingredients which are cancer causing, because there are lots of things which are, for example, banned by FDA or other European institutions, and we are still using them in Pakistan.
That's very problematic, and that's something that should be easy to control. That's very scary, actually. All these sort of horrible chemicals are in our food that, abroad they're not allowed to use.
Yeah, so we don't need to reinvent the wheel, because if something is already, globally banned, it should be banned here as well.
Quite right, absolutely.
So one of the aspects is that call in our call for action that. And then we don't have National Cancer Registry. It's been for last 10 years we have been advocating that we should have cancer registry, because answering your question, how can we have exact statistics when we don't have National Cancer Registry? So we really need to see the trend in last 10 years. But generally what we have seen is, for example, we go to lots of colleges for our youth program, and unfortunately these days we see that every college has one or two young girl being diagnosed with breast cancer. So somehow there is a rise in young girls being diagnosed with breast cancer in Pakistan, again, which is a bit unusual, because globally the maiden age is 55 years. But in Pakistan, the average age is 35, and then we see girls in like 19, 20, 21 being diagnosed with breast cancer. So that's a bit of an unusual trend.
Oh, that's kind of worrisome, but okay. I'm thinking about this for a minute. So, Dr. Aziz, we were talking about genetic testing. So, what kinds of tests? There are a few tests available that people can take, but do you recommend that people take these tests?
We recommend that at present there are certain types of breast cancer where ideally those patients should get testing.
Right.
If you have a strong family history, you should get testing. In the next year or so, Europe and North America are going to say that every breast cancer should be tested, but right now it's a subset of breast cancer which needs to be tested if you have no family history. And patients with a strong family history of breast cancer, ovarian cancer, they need to be tested.
Okay.
And the advantage is that you have several targeted therapies for the genetics if they're abnormal, and then you can also plan for your family, for your siblings, for your first cousins, that yes, this is a family history, let's look at it how to deal with it. It's a very interesting article I was reading that in Israel, the family history, BRCA1 and 2 testing is common, and one of the mothers had BRCA1 testing done, and her daughter was also positive. So she was forcing her daughter to get married early, so that she could have kids and then she could have a mastectomy. So the daughter is 21. I was reading, it's a real article.
Yeah,
so
it's actually really relevant because.
So she said, why should I get married now? I want to enjoy life. Now here there's a fight between the mother and the daughter. No, you should get married and have kids because I need you to live. The daughter's saying, I don't care. I want to enjoy life. I don't want to get married. So this is
it's a thing.
It was very interesting, and I said this happens all the time.
But it's also though possible that even if one tests, for example, for this, and let's say that it comes out positive, and you do have that gene, you can also manage it.
You see, the
monitor.
problem is there's not one gene. There's several genes. Some are high penetrant genes.
Right.
High penetrant genes means that there is an 80% chance of developing a breast cancer or 60%.
Right.
Now the low penetrant genes, there's a 3 to 4% chance. That is not as common. So the high penetrant genes also, it depends on where the gene is hit. I don't want to get into that.
Right.
So it's a 60 to 80%. Now if it's a 60 to 80% chance, then you're really scared.
Right, that's true.
But if it's a low chance, you can manage it. But for that also, you have managing strategies of how to get a oophorectomy or take medicines to prevent it and to be on a regular follow-up. So all is not lost.
Okay.
Then you have targeted therapies.
Yes.
Which will target that defective gene and inhibit that function so that you can... So basically, a lot of work is being done. And there are some of our patients who are taking that medicine. It's very expensive, but they're taking it.
Which brings me to my sort of second strand here, is that a lot of these very advanced and really sort of effective sounding therapies are available, but they're incredibly expensive.
That is true.
And I think that, Dr. Aziz, you mentioned to me before this show, in our private conversation, that patients who can afford these therapies, it's a very small fraction of patients who can
it's the upper class who can afford it. Because, you can't give it to the masses. It's too expensive. That is why you need cancer registries, as Omer mentioned, because the government can plan. You can allocate resources to that disease. You can have the power for early detection and say, okay, let these patients be cured who are there. And that is why knowing what diseases, not only breast cancer, but everything, from infectious disease, from this, from that, you should know what you're dealing with. You allocate your resources. Like right now, it is a knee-jerk reaction. Okay, this cancer is common. You see in the television, we are advertising breast cancer. There will be a show and the health department will one-time stipend for that. Then all is lost. Now, if you have a scientific way of determining what are the problems you're facing, and the non-communicable diseases are rising in our country. It is obesity, it is hypertension, it's diabetes, it's cardiovascular diseases, because nobody is paying attention, as Omer said, to a healthy lifestyle choice. The processed food which we eat.
Yes, which is full of those dodgy chemicals.
McDonald's, KFC, nobody says, why are the kids eating that? Why is there so much obesity and diabetes in the young kids? You see these toddlers walking like this, galumphing around. So the thing is that we need to have a sustained campaign, and billions of rupees are spent on all this. Why can't we have an organized campaign? We should be planning our resources, and we have scarce resources. It's not that we are very rich or something.
Quite right. So which makes it even more urgent and
essential.
Focus on what is needed and that
allocate resources there.
And I think at the moment there aren't very many government funds allocated for any of these.
Taking forward this Dr. Zeba's comment, one of our call for action point this year is to have a national cancer prevention program, because again we don't have a national cancer prevention program. This is a WHO model. Every country has it.
Really?
But till date we don't have it in Pakistan. How can we have a holistic plan if we don't have a national cancer prevention program?
We have a plan, but it's on paper.
But then that's of no use.
Yeah,
that's nice to show other
It has to be
hospitals.
prevention and early detection. Now, if you have that for every disease, you're going to, save so much money.
Yeah.
And your people will be healthy. They'll work for longer times. And, you're having these cancers or diabetes or hypertension in their 50s when that is the most productive time of a man or a woman who's working.
Quite right.
The children are growing up, they're going to, all of a sudden you find all your resources are spent on your ailing parent or your sibling or whatever. So the point is that unless we have organized resources spent, we have cancer registries, you have a registry for diabetes, for depression, for whatever
Right,
disease.
yes.
And then allocate your resources like that. Don't have a knee-jerk reaction. One politician's wife will have a cancer, so all the resources will go there one time. No, that is not the way.
No, there has to be sort of sustained approach.
Organized approach, you should plan, you should do something
That's
about
what a sort of a national prevention program would
early
entail.
detection, prevention, and like stomach cancers are going up. Why are they going up? Because you have a lot of infections in your stomach. You eat garbage in, you get garbage out.
Gosh. I'm going to ponder on a lot of very serious information, and we're going to take a very quick break. Stay with us. Welcome back to the coffee table. We're talking about breast cancer and raising awareness for this show with Dr. Zeba Aziz, who is a fantastic oncologist, and Omer Aftab from Pink Ribbon, Pakistan. So, Omer, tell me more about this call for action, because I know that there are a lot of really interesting and valuable points on this sort of plan, and I want to know more about them.
Yeah, so for 16 years, we have been raising awareness on early detection and all of this. And for last 3 years now, government is supporting us as well for
Only the past 3 years.
Well, at least so for last 3 years. Yeah, so this year we thought that now from this we need to move forward our agenda. So we have come out with some very strategic recommendations. So one is that, just I said, that we need to have a cancer registry, we need to have a national
What would a
cancer
registry do? It's basically for data collection and to sort of see that who's had it when and
Yeah, exactly.
things like
We
that.
need to see that, for example, which
areas
age
have
group,
more of it.
which particular area, all of those kinds of things. How can you plan something if you don't have specific statistics? And then this National Cancer Prevention Program. And then what we are recommending is that at least we should have mammogram facility at the district headquarter hospital. That's minimum which we should have. And then on the other hand, for example, there is an issue that chemo is not covered under the health card. So we are suggesting government to please include chemo as well in the health card. That's very important, because that's where it's the most expensive part for the treatment. And then still there are what we are suggesting is to abolish the import duty on the diagnostic equipment, because it's very expensive. To have maximum diagnostic equipment in Pakistan, if government waves
Which would
off.
include things like mammogram machines.
Exactly, the mammogram, ultrasound, all of these things. So we are not saying that they should give a subsidy, but at least we are saying that they should abolish custom and import duties on that. We are also recommending that they should abolish duties and taxes on the chemo and other drugs as well, because these are like very, very expensive drugs. And lastly, what we are also recommending is that all the molecules are not allowed to import in Pakistan. There are some molecules for which you have to take special permission for patient to patient. So what we are also recommending...
It sounds like a very complicated process.
It is, unfortunately. It is. So we are also recommending that all the molecules which are useful for breast cancer treatment, all of those should be allowed.
Dr. Aziz, what are these molecules? They sound very fascinating. It's probably targeted treatment.
Targeted therapies for a certain set of breast cancers. It's not, the expensive ones are not for all breast cancers. They are for a certain set, which is the HER2 positive disease, where the treatment, but you also have biosimilars for that, but still it's expensive treatment for 1 year. And when you get more and more biosimilars, the prices may come down. There are some access programs also available, but it depends. Still, it's an expensive treatment, but not all breast cancers require that. So some of the breast cancers can, if detected early, can have some chemotherapy, which is not that expensive. And I think I'm saying it's not that expensive, but within 2 or 3 lakhs, the treatment will be covered. And the only other major issue is radiotherapy machines, because the government has not improved the quality of radiotherapy machines. Now, if more and more women are going to come in early and they're not going to have their breasts removed, all of them will need radiotherapy. Now, the waiting time in a government hospital is at least 4 to 6 months. Now,
and then by that time, your disease will have progressed
or half-heartedly, and nobody knows what is happening. So, unless and until, that is why cancer registries are important, because you need to allocate resources for whatever. And radiation machines are not only for breast cancer, but they are for other cancers also. So, if you're taking cancers as such, then you need to improve your human resource, your infrastructure, how to diagnose, and the most important thing is create awareness among men. So that
yes, Kevi, let's talk more about this, because yes,
I feel that going to masjids, and telling them, because the men are listening to the...
of course, and you have many men in one, gathering.
I don't know how to do it, but somebody will have an idea, and maybe
Omer will have
an idea of how to approach men in the masjids and create awareness about women's health.
So for men to kind of go home, and because the majority of women who are the ones with this late stage cancer who are dying.
They are basically from the villages and the poor women. Now, if a man knows what is happening, he will ask his wife repeatedly. And the message only once is not enough. There are so many other problems that it goes to the back of your mind. So wherever we go, it has to be a regular sort of feature, not October alone, but otherwise
throughout the year.
Yes,
but I think it's a really important point, because a lot of women from that particular kind of background are dependent on men to take them to hospitals. Sort of take them to the doctor, to even take it seriously in itself as a problem.
You know what I've seen in my 30 years of practice? A woman has a good husband or good sons. They fly through chemotherapy because they literally, you've heard that they're taking it through them. They will support them, they'll look after their food, they'll do it. A woman whose husband doesn't care or who does not have good siblings or children, that woman is miserable. She'll leave her treatment in the middle. There's, somebody will
no
come.
Motivation to get better.
Not only the motivation, there's nobody to bring her. So what I've seen is that the side effects also are minimized in women where there's a strong family support, especially the husband support. That is the most important thing that you need. And if the woman is older, her children. And I cannot emphasize that enough.
What do you feel in your outreach programs? Have you been approached by men who want to know more?
Of course, we do lots of sessions. And by the way, one positive thing is that, for example, on our helpline, in last 2 years, we have seen maximum calls from husband or a father or a brother. That's excellent. We now, in like 3 years back, we used to have calls from a very worried female scared about her disease, but now maximum calls are from a male member of the family, and they are really concerned. So this is a positive change we have seen in last 2 years, because all of this program we have been running, for us it's not October, it's all year. And we when we go to, for example, lots of colleges, universities, we engage it's not just for female, it's for men as well. Then we do lots of outreach program with men
and
as
of course,
well.
I'm sure social media also helps and have a sort of presence and more outreach.
Of course.
Social media, television, radio are one of the... are the most important things. People have stopped reading, so newspapers are uncommon and books are. But the social media is, I think, one of the most important things to spread the message.
Quite right.
But my message is men are still the most important part in the woman's life.
So in terms of the treatment, so in our capacity, Pink Ribbon is setting up a dedicated facility. Yes, it's a medium-sized facility, but to start with, we are building it in Lahore. Half of the building is complete. We just, the schedule delayed because of Corona, everything stopped, but we are very hopeful that by next year, inshallah, at least some treatment will be up and running. So this will be a state-of-the-art facility, a dedicated facility, and this will be a model, and then we can, replicate. We can replicate it in other parts of Pakistan, inshallah, as well.
Excellent. That sounds so promising and so important. And thank you so much, both of you, for being on the show and, telling us so many really interesting and important things. I've learned a lot, and I'm sure all of you have as well. Remember, this is a struggle that goes on all year round. It's not just October. These are conversations that we need to keep having with each other, with our family members. Know your body, be in touch with your doctor, get a checkup, prioritize your own health, and prioritize the health of the people around you who you love and care about. Thank you for watching. We'll see you next time on The Coffee Table. Bye now.